Hello, me family, and welcome to another exciting episode of Wellness Program, where they come to you live on Redeemer Television Channel 25 every Thursdays from 6 p.m. to 7 p.m. And also you can follow me on WhatsApp channel wellnessorg.sl. And me, I presenter for today, Shirley Rosalia Williams. Yeah, so we look at everything we concern well body. We look at the physical, mental, emotional, spiritual aspects, and all things where will keep you fit and strong. Before we go with the program, make we watch what Papa God in word say inside Proverbs 24 verse 13. Proverbs 24 verse 13 saying, "My son, eat thou honey, because it is good, and the honeycomb which is sweet to thy taste." Okay, so we want to finish the program before, and we want for today, we want for watch one sick way, of course, but people them don't defend challenging, whether young or old. Now one part is sick that way. A lot of people then don't afraid. So for today, we topic now diabetes strategies for health and wellness. Diabetes strategies for health and wellness. And as always, we get the master sabi person where they come this topic, yeah, so for we. So want to welcome Dr. Amara Jessie. Dr. Jessie Amara in the studio. Welcome to the program.
Thank you very much. I'm so happy for there, and I greet you all in Jesus' name.
So you yourself, me listener, thank you for joining us today. And if you want to be part of the program, you can call or send text message to 079-716-255, 079-716-255, or if you can drop a comment on we social media page on YouTube, Redeemer Media Television. You can drop a comment on a feedback concerning the topic we talk today. Okay, so let we most that so we want to dive into this program, waiting na diabetes and how person will be tested, how person gonna say get diabetes.
All right, I know say from where we born with all this diabetes,
Yes.
where some people they can normally call say a sugar sickness, okay, that the common people can say sugar sickness.
Yes.
But according to the medical side, waiting they say that diabetes na a clinical syndrome we characterize of hyperglycemia, carbohydrates, fat, and protein metabolism disorders due to insulin deficiency or insulin resistance or both. Okay, so now then diabetes according to medical and WHO standard definition. All right.
Okay. So in your definition, it means saying that we possibly intake more carbohydrates, or like we're more carbohydrates and fatty food. And what's the other word? The first word we call? Yes, we're inside your system.
Okay. So I mentioned say a clinical syndrome which is hyperglycemia.
Yes, the hyperglycemia.
So hyperglycemia means increased blood sugar. Hyper means high. Glycemia means glucose in the blood. Okay, so now that what they mean. So you get more sugar in your blood. Okay, and this sugar here now because the body, I know say most of we do biology. Okay, in biology we get what we call metabolism, not so, and we get two. We get anabolism and catabolism, and they tell we say more time than we do more of catabolism. That's when they take in complex food and break it down to a simple one. Whereas plants they do anabolism, that's then take simple food, they make them into complex one. So because of the thing that we will take in the body, they're complex. So the body, because of this problem, you're not able to break down carbohydrates fine, you're not able to break down fats fine, you're not able to break down the protein fine. So because of that thing they are, the end product mostly can lead to glucose when I we need for make a strength, when energy. So then they go na the blood they will go there. So then they lead to the hyperglycemia. And now because of it's either get the endocrine hormone where they call insulin, where responsible for reduce sugar in the blood. It's either they make them or you they make them, but due to a reason when we not too clear, the cells then they resist the insulin for act on them. Okay.
Okay. Okay. So, who's kind individual or who's kind person way for go test for diabetes, because some people then can get and say, I like they eat sugar, they need to get diabetes. Some people then just get a confidence there. Other people then now any afternoon they go test for sugar, any afternoon they go test. So who's kind of person we go they at risk, we go they at more risk for they get diabetes.
Alright, so diabetes as I said is a broad topic, very broad. So you dey ask who that they at risk. Mostly
Yes,
we
most.
not can know. We can pick them up like on a routine visit when you go to hospital based on certain clinical symptoms then or complaints the way you go come. But at times you know go complain on this, then we decide for do the test. They will find out say sugar dey high. Okay. So me go say let everybody do the screening test for make you dey at a safer way for make you know say you get am. And you mention say some people and say that they eat sugar as you hear where they talk, not to sugar they no more they get diabetes.
As
Okay.
you rightly don't believe.
Exactly. So that na false motion say na sugar. So even the carbohydrate food, so carbohydrate food na waiting. The rest so they eat not so
Yeah.
carbohydrates. The cassava way they eat na carbohydrates not so.
Yes.
Potato way they consume carbohydrates. The oats, Quaker oats way they eat carbohydrates. So fats, protein, beef. So then thing and they all the end products they contribute to make you get hyperglycemia where they lead to diabetes. Okay? So you know why so say I mean sugar normally eat where they eat boku white rice and not make no sense and no work done. Because insect self they give you diabetes. When we get for talk about the types of diabetes, then I go able to expatiate more on whether they are the category of people that we predisposable for getting as we go.
Okay, so where person get diabetes, like putting as some kind of health challenges them or complications them where this person has to go face during this period as when to get diabetes.
Okay, I think say alright, so we don't combine the end and the make it so but it's okay.
Okay.
So we get 3 or 4 types of diabetes, okay?
Okay.
We get type 1, we get type 2, we get diabetes of other causes, then we get what we call gestational diabetes mellitus.
And so talk over we get type 1, we get type 2, we get what's it?
Diabetes of other causes.
Diabetes of other causes.
Yes.
And then
We
we
get
get
gestational diabetes.
gestational diabetes. Okay.
Yes. So the most common of them are type 2. So some people they can even put gestational diabetes and other causes under type 2. Okay, so na extension of type 2. But para also na type 2 na more common. So now the world, according to the epidemiology, out of 100% of if you check the people that will get diabetes, only 10% are they will count type 1. The 90% all are type 2. So now in more common. But how you go able to know which is which? Now talk about gestational. So gestational means you get belly, okay? I make you go to gynae, they will tell you say waiting at guess you go you already talk about gestational age. Alright, exceeding 34 weeks. Okay, 35 weeks, that's the gestation. That means the pregnancy when you get, okay? So this one now, you not be get diabetes. But when you get belly, you find out so when you go to the 2nd or to the 3rd trimester, the way they check you, you find out say sugar they high, you get diabetes. So naturally you not get that, but now because of the belly, I make you get diabetes. And studies don't show say 50% of women they will not get diabetes normally, but when they take belly, the 2nd and 3rd trimester, they find out say they get 50% of the one they will develop gestational diabetes. Gets likelihood for let them get the diabetes in future. Okay.
That's like after pregnancy, just for the clear. After pregnancy can be say the diabetes can stop or they disappear.
They disappear.
And then
normally it can disappear.
Normally they disappear
Yes.
after pregnancy.
After they pull the pikin, mostly about 3 to 4 weeks it can subside.
Okay.
But the one that we can subside, studies show say 50% of them later in life they will get the diabetes. So now you make you as a medical personnel, you the patient, we don't get better than tell you say you get that sugar sickness. They go find make you get surveillance, which so this is monitoring of your blood sugar, so that you could know when you want to start and you manage them properly without any complications. So for type 2, as I say, so that was type 2. Type 1, we get a normal common name we can call them. So type 1 we say now insulin dependent diabetes mellitus. So mostly when we say diabetes, we can straight think saying diabetes mellitus for get and clear. But we get two. We get diabetes insipidus and we get diabetes mellitus. But generally, as medical practitioners, when we say diabetes and mellitus, we mean if we talk of insipidus, we can talk about. So insipidus, in the type for TIC, you get urogenic or nephrogenic abnormality. You get one hormone where they call ADH. Okay, ADH they control how much water they pass. So that one they will get insipidus, it bespoke and it tasteless. Whereas in diabetes mellitus, the wet in tasty, in sweet. And also you wonder how would I know say that is sweet and that is tasteless. First then they actually they be the taster. The things medical people do for us.
Yes, and I think one common way me auntie can find out say person like you need to go check yourself for diabetes is that if you wet na gone, commonly if you wet na gone, you know to water was not they see then sugar anti that the camp and the wet. So you don't know, so you need to go check yourself for diabetes because like the thing that taste like they attract the sugar anti. Okay.
Because of glucose in the area, so in the blood, so called glycosuria.
Okay, so what about the diabetes with other causes?
So diabetes with other causes like now more of like hemochromatosis. All right, these are other genetical conditions we're not related, but through one or two genetical mutations or abnormality they predisposed to high blood sugar.
Okay, so that it could be so where the parents they come together.
Yes, because so, anything that genetical you inherit. So now the major difference that's between type 1 and type 2. Type 1 mostly not due to genetical what we call autoimmune antibodies. So waiting anemia, you white blood cells then they see the pancreas where they produce insulin. It's a strange thing that they attack and destroy.
Okay.
The beta cells of the islets of Langerhans and the pancreas really secrete insulin. So when they destroy that, you know they get insulin again. So now you make call insulin dependence. That means say for the rest of your life you need insulin. And the management. There is no medicine or the ocean and insulin you need.
You just go for good take continuously.
Yeah.
Okay. Wow. So we person don't find out say he get diabetes, unlike that belly woman, it able like reverse some, like not forget them, like take treatment and was not saying you know get them again, like the diabetes loss. Aside from the belly woman, we be say gestational diabetes. So apart from that, any other person can able reverse diabetes.
Well, if I accept not to quack, you go to. But if you go to a certified medical doctor like us, we will never tell you that we treat diabetes. We will tell you say with the manager.
Okay.
Because you know the treatment management. So once you get them, now for lifetime, you're on medication for lifetime. Okay.
So you need for constantly there on medication
and monitoring and blood sugar monitoring. Okay. So we don't talk about the type 1, the type 2, gestational and diabetics with other causes. So of them 4 there, so who that them they at risk more forget anyone per the one there, so especially age balance. First time with the people then say now all age and first they get diabetes, but we don't just see young people themselves don't they come out where they get diabetes, and we don't of course the year of death them way by diabetes. Diabetes in begin I make it in die. You understand it? So other than they at risk more for get certain, let's say type 1, type 2,
gestational, we don't get our understanding this in our belly, and other causes then we don't understand now. And so type 1, type 2, then they are at risk more. And if let's say proper type 1 is in an insulin, so obviously if without the insulin the person will die.
Of course.
Without the insulin,
without the insulin, you decline rapidly into a state. So that's one of the complications they will call the diabetic ketoacidosis. Okay. We go candy. Okay, so you they ask whether they're more they at least. Okay?
Yes.
So for type 1, you be the talk about age. All two can happen across age, but type 1 more common among younger people.
Younger.
Yeah. That's people below 35 years.
Mm-hmm.
Whereas type 2 is more common among older people. People above 45. So if somebody come now 18 years old,
Mm-hmm.
the most likely diagnosis
Mm-hmm.
na type 1. The most likely. Because na is more common among young people and in due to autoimmune antibodies that we secret. Okay? Like because you get a mutation in which we call the HLA-DR3, DR4 leukocytes then at the body where they attack, they produce and cause their mutations there. Okay. Type 2 mostly, as I say, old people, and if you obese. So obesity na a risk factor. And not the cause, but na a risk factor different from the cause. So when you get body tumors, especially around the trunk, the belly, can predispose because you get high tendency for get insulin resistance. That even though your body they produce insulin and not the act, because insulin are like a key where they go open the domot na the cell for the sugar can inside. They get drink.
Okay.
But in this one, it's like say the key now fits na the domot. No? So if you put any open self. So even though you get insulin, but you're not open the domot for the sugar go inside. So obesity can cause that. Infections can cause that. So na a risk man also cause a risk. So these are some of the risks for type 2.
Okay. So if they talk about complications, then one person will get during diabetes stage. Like what are some of the complications that one person can get during this stage? So.
Okay. So the complications are vast. So one thing what I mentioned that diabetes mostly can work out hypertension. Okay.
Apart there.
Yes, exactly. Just like in our age, tuberculosis mostly they work out HIV/AIDS. So now alucine and alasan they can make it okay.
Yes.
Now only few cases they go come when they isolated, but mostly I make we can say test, let we know quick so that we can prevent in progression. Of course, if you left a progress, likely you develop hypertension. Gonna one of the complications then. So we get what we call the macrovascular and the microvascular complications. So under the microvascular complications, we get what we call retinopathy. That's the eye, they unblock the eye. The blood vessels in the eye they're strong, and it begins to see like darkness. The person will begin to talk like say in it they see dark around. And
partial blindness, or that's different. Partial blindness.
They go see darkness, and with time they be completely blind. Okay. Then you get what we call the nephropathy. That it affects the kidneys. Where it affects the kidneys, it cause the blood sugar, you know, the sugar, the glucose, you know, they able absorb na the kidney, and then they come on the urine, and it's urine glucose or sugar na osmotic agent. Inside glucose they drop water. So these are some of the cardinal signs. So before we don't talk about the complications, we don't talk of the cardinal symptoms the way they see in diabetes. So what we call cardinal, these they're mostly always there. So one now what we call polyuria. Polyuria. So poly means boku. Urea means urination. So the wet boku.
Okay.
Then we get what you call polydipsia. Poly means boku. Dipia means thirst. So the person is thirsty and they drink boku.
They drink boku and they wet boku.
Exactly. Then we get what we call polyphagia.
Polyphagia.
The person, poly means boku, phagia means you eat. So the person they eat a lot.
They eat a lot.
But it's not commensurate with your body. Still, they get weight loss. So
Okay.
the fourth one, an unexplained weight loss despite good appetite.
Unexplained weight loss despite good appetite.
Yes.
Okay.
Then the last one are glucose, urea, sugar in the blood. So once you see them five, they are not. You just go do test as a clinician for confirm. But yeah, 100% or 99.9% chance say the person get diabetes. So back to the complication. So the nephropathy, as I say, it can cause what we call nephrotic syndrome, where affects the kidney. That's the person they pass boku protein out, boku urine, and some amount of red blood cells, although not much. And then they make like a decrease on oncotic pressure, right? And that and also we get what we call the neuropathies, that they affect the peripheral nerves them. And where that need to happen, now that need to make the person can either get painful sensation at the hand and foot or a lost sensation totally. So now that need make, if you see that they must sharp something, they know they know. Now I make when person get diabetes, they can always advise all left sharp things them around now go.
Because you got to damage yourself
And
without
no, they
you
know. Because in sensation, the sugar don't damage the nerve cells them. So you know they get that sensation, they loss. And at Danny mostly in where it can cause where the wound, they're not able to take care of it. It gets infected, it gets necrosed. That means say it die, the tissue die and dry, so pass to cut that foot there.
Wow.
Okay. Then we get the macrovascular. Macrovascular mostly now what you call ischemic heart disease. So because of atherosclerosis, that's what it means that when they get fatty deposits then at the blood vessels, they become strong and calcify, strong, they're not able to stretch again, increase pressure, then they lead to ischemic heart disease. In other words, the blood is suffer because they get the heart they suffer because they get enough blood for survive. The heart will supply we itself need blood. So when it gets atherosclerosis, especially in the coronary artery, we're responsible for supply blood to the heart, then the heart can die, and we get what you call ischemic heart disease, or what you can call myocardial infarction or heart attack.
Heart attack. I think that's the most common one. I don't believe one that is that.
Exactly.
Heart attack. And
Then it can progress to stroke. Okay, to stroke.
Okay.
Yeah.
Okay, so we don't get mutual understanding, say type 1 without the continuous insulin intake in the die.
Yeah.
And then type 2 waiting or cause for make in diabetes lead to death.
So like type 2 is just like which I don't. So type 2 first we always they start with diet management, okay?
Diet management.
Yeah. So we'll tell you say not eat white rice, okay? No eat things that we get boku glucose. Sugary then sugar things them thing we get boku sugar. White carbohydrates. You control your calorie intake. We restrict to get the values the way you go take the calorie intake. So all that now for make clear you sugar candle. So in the area of the diagnosis, as we do that, we will monitor your blood sugar a period of 2 weeks. Okay. So according to WHO, we get 3 ways and how we diagnose.
Okay.
First, we get what we call the fasting blood sugar. This are the talk in a non-pregnant individual, because pregnancy they value them different.
Okay.
So in a non-pregnant person, the fasting blood sugar, that means if you don't do 8 hours, you not eat. So then now we call fasting, not like how they fast now. 8 hours, you not eat. So after 8 hours, we check the sugar. Enough for be greater than 7 millimoles per liter. Okay.
Okay.
And also, or if you don't eat, we get to what we call the random blood sugar.
That's not the second one?
Yes.
Okay.
The random blood sugar now, then you don't eat. We will check enough for be greater than 11.1 millimoles per liter.
Okay.
And also,
The third one
we get what we call the oral glucose tolerance, the 2-hour test. So then we give you 75 grams glucose. They'll check 2 hours. We can check your blood sugar. it not for be greater than 7.8 millimoles after 2 hours where you don't take that sugar there.
Okay.
So if it greater than it suggests say you dey in a diabetic, you know, you confirm the diagnosis of diabetes.
Okay.
So these are the three way according to WHO standard who they use for diagnose diabetes. So we get another one we we'll call the HbA1c.
Okay.
Then in the try for measure for the past 3 months how you don't in glycemic control, how you control the sugar. Okay, so in not for be greater than 6.5%.
Okay.
Okay, so then you can use for monitor mostly when you do on the treatment. Well, let's see if we make progress.
Okay.
Okay, because one of the okay, I don't. So one of the more common complication is like you demand something but it cause trouble. We call iatrogenic cause. That's called due to medication. Now hypoglycemia.
Hypoglycemia.
So we'll be talking about hyperglycemia.
Yes.
When I in the diabetes. So now I don't talk about hypoglycemia.
Yeah.
And I talk say hyper means waiting high. So hypo means waiting low.
No.
So due to some people then can want to treat the high blood sugar so aggressively, they can tend. So if they abstain totally from anything carbohydrates, anything glucose related, and that's they make you get hypoglycemia where in they kill faster self. Because when you go into a hypoglycemic state and that you your blood sugar less than 2.2 millimoles, you get certain autonomic symptoms then that you will begin sweat, person will begin nerve. So you go find that people the way they get this state here for no. Once you begin nerve, you begin sweat profusely, you feel weak, tired, you begin confused, you're not able to concentrate. So call them decline in your cognitive state, sir. You're not able to focus, you're not able to concentrate. So that is right for tells you are going to a hypoglycemic state. Okay? Low blood sugar. So mostly the one the way they can come to hospital, most they can come in a comatose state, in a coma. They don't lost consciousness.
Yes, have consciousness.
Yeah. So one of the first line treatments we can do now for give them dextrose 50%, and within few minutes you will see them
Then come back to.
So that can happen because the person they take medications then in strict control. So
they take them very, very serious,
exactly.
over serious.
Exactly. So for type 2, not type 2 we they talk about. So for type 2, insulin is not the first line. So you first start with diet. So after 2 weeks we'll measure if we see say the diet not they do the work, and exercise. You get for the diet and exercise. If you know the work, that's when they will introduce pharmacotherapy, that's medicines then. Okay, so the most common one way people can take now is metformin or so. But you get other one, they want to go call because I know encourage you for
pepper doctor.
So if the pharmacology, the monotherapy, that's they use one medicine, then we can combine. If we combine work, then we can combine plus insulin. So when we use insulin in type 2, that is now the last sign now.
The last stage.
Yeah.
And then if that didn't work now,
you're on good.
Okay. So you make mention a couple of times of glucose, right? And you make a member say, most time they can sell them glucose tablet in a street. Most time then. And a couple of times, granny especially, granny from BAM, and the BAM with the knowledge saying glucose fine for the system. Plus, if we're going to take glucose for energy, I think you always take them. You understand him? And you don't make mention of glucose a couple of times. So we just want to clarify that fact. Glucose, what was the intake glucose? And get anything for affect the sugar level, blood sugar level, and if it will lead to diabetes, or is it purely for energy, as we people there understand?
So I also be the mention about hyperglycemia.
Yes.
Glycemia, that increased sugar. So it's from the word glucose. So like already we they talk about carbohydrates. So now I've mentioned that's about metabolism. I go through catabolism. Say we they take in complex something, we reduce them to. So carbohydrates are a complex substance, and in simple substance, with everybody know now it's glucose. So it's the simple form of carbohydrates.
The simplest.
Where you don't break them down. Okay, like we eat them, we ingest them, it go through the metabolic process in the body. Okay, so it can give it glucose when in the cells they need for get energy for drink. So I make a mention say if somebody come with hypoglycemia we get low sugar in the blood, it into coma. With the gear dextrose 50%. So in a form of glucose.
In a form of glucose.
Yeah.
Okay. So I mean, any kind of right.
Yes.
Kind of right. Okay. So for them, the program where you they watch now, the wellness program when they come to you every Thursdays from 6 p.m. to 7 p.m. And of course today we will look at diabetes strategies for health and wellness. Diabetes strategies for health and wellness. And of course we get with Dr. Jessie Amara with the digest this topic. We want to go on a short break, no go any side. We want to look at the benefits of exercise. One thing where doctor say one way for treat type 2 diabetes now it's in diet and exercise. So we want to look at somebody benefits them of exercise. No go any side, we'll be right back.
In this video, we're going to look at some of the major benefits, both physical and mental, that an exercise program can bring to your life. Let's start with the physical benefits. Number 1, cardiovascular and respiratory improvement. Over time, you end up strengthening the cardiac muscle that surrounds your heart. You also pump a greater volume of blood with each stroke, which causes a decrease in resting heart rate. You develop more red blood cells, which improves your ability to bring oxygen to your muscles, and your lungs become stronger and better at supplying your body with the oxygen it needs. Number 2, reduction in health risk factors. Regular exercise can reduce your risk of cardiovascular disease, developing type 2 diabetes, and metabolic syndrome. Research also shows that active people have a lower risk of colon and breast cancer, and regular exercise can also increase your chances of living longer. Number 3, increased metabolic rate. Metabolic rate is the rate at which your body burns calories. During exercise, you obviously burn more calories than when at rest. However, your metabolic rate at rest is enhanced even after your workout session is completed, as your body uses energy to repair muscles and replenish ATP storage and glycogen storage. This does depend on several factors, including the intensity of the exercise and your current fitness level. Number 4, decreased risk of falls. Incorporating balance, coordination, and muscle strengthening activities into your exercise program can improve your motor skills, thus reducing the risk of falling. Number 5, bone health improvement. Impact activities such as plyometrics and jumping and resistance training can slow the loss of bone density that comes with age. Playing sports that involve running and jumping can be advantageous as well. Number 6, weight loss and reduced obesity. Physical activity can be a key part of a complete weight management plan to avoid excessive fat gain and to maintain a healthy weight. Regular exercise burns more calories and increases muscle mass, both of which are key to weight loss and weight maintenance. Now let's take a look at the mental benefits. Number 1, increased feelings of well-being. Exercising enhances the action of endorphins and enkephalins, which improve natural immunity and reduce the perception of pain. Regular exercise can also improve mood, feelings of having more energy, and overall quality of life. Number 2, better sleep. Research has shown that regular exercise helps people fall asleep faster and enjoy a deeper sleep. It can also improve sleep duration and decrease middle-of-the-night wake-ups, providing a better overall sleep quality. Number 3, better brain function. Regular exercise can reduce fatigue, which can improve alertness and concentration. Physical activity improves blood circulation, which delivers oxygen to the brain at a faster pace, which leads to sharper thinking. Number 4, increased self-esteem. Regular exercise can improve your body shape, increasing your confidence in your appearance, thus increasing your self-esteem. Exercise also promotes a sense of accomplishment, which can increase your confidence in taking on other tasks in your life. And that would be some of the major physical and mental benefits of an exercise program.
The program we they watch now, the wellness program when they come to you live every Thursdays from 6 p.m. to 7 p.m. Don't forget, so you can be part of the program by where you go watch me on my Facebook and YouTube page, Redeemer Media Television. And The topic we would watch today now, diabetic strategies for health and wellness. Diabetic strategies for health and wellness. And you have done deal with me from the start of the program, of course. You know, so this is a very exciting and very educative program right now. And I believe so you don't learn a lot. So we want to continue with the program. We got with Dr. Jessie Amara for deliberate more on this topic. Of course, it make mention say the first one are gestational, yes, gestational diabetics, and we want for dive deeper into this gestational diabetics. Like we belly woman, first we get belly, and attending get diabetics. Waiting as somebody affects them when go get para woman there and save the picking within the belly.
Okay, so before I go and I go on for give you the values for diagnosis of diabetes in pregnancy. So we get two. Okay, we have what to call diabetes in pregnancy, and we have what to call gestational diabetes.
Okay, so then two different.
So diabetes in pregnancy means that this person don't get diabetes before you get belly.
Okay, and then gestational now the belly na how the pregnancy. Okay,
so now the two difference than the and diabetes in pregnancy, that means if you get diabetes you want get belly, you need for plan with your gynae, with your obstetrician, okay?
With your doctor.
With your doctor. Yes, with your doctor, because it can be get various complications. Then we can want to try for balance as we can put. Okay, so as I mentioned earlier, gestational in from the second to third trimester, you will see when the test they will develop. Okay.
Yeah.
So mostly you confirm them between 24 to 28 weeks. So how will you diagnose? Now just the same step: fasting blood sugar in and I will say for greater than 7, not so. So in this one now, if for day between 4 to 5.5, according to the NICE criteria. Okay. So if another between that range there, then we can say you get gestational diabetes. We'll check out. Then are you fasting? That as I say 8 hours, you know it. If now the random blood, if for day between 8 to 10. That one, I'll be say the random blood sugar now waiting 11.1 in a non-pregnant person.
Yeah.
Also, we get what we call the 1 hour glucose tolerance test and the 2 hour. But the 1 hour is not too significant because it's not suggestive of diabetes. Do not use that for conclude. So the 2 hours test or a glucose tolerance test, if you don't go to a cottage before, mostly they can do one where you go there. In when and check the after 2 hours if they less than 7.8 millimoles. If they're above, then it confirms say you get gestational diabetes. Okay. So waiting at the effect of diabetes, hyperglycemia in pregnancy. One of the things we get waiting we call the growth hormone, cortisol, human placenta, lactogen, where all they cause increase insulin when you get belly. They mimic the effect of insulin at the receptors. Okay. So because the mama get too much sugar in the blood, they go inside the pikin. And we go inside the pikin. One of the major thing where they do now, what you call a macrosomic baby. So macrosomia means the pikin too big. So greater or equal to 4 kilogram. So if you picking and born na 4 kilogram and above, one thing, especially if you're not born na a recognized hospital where they do them tested because of woman and a post they born and all. It means say you need for check your blood sugar, because it means say it's either you get diabetes in pregnancy or gestational diabetes.
Okay, so both can get an effect for make the pikin later on get diabetes.
For let it be, so now the effects are they tell you what's for the pikin.
Okay.
So that need to make let the pikin become a macrosomic baby. That means it's big for age. Big for gestational age. Because we get what we call the normal range for picking them. So anything about above 2.5 to 3.9, we can say nanina the normal range, or 3.5. That's for normal delivery, because for the obstetricians then 3.99, like you want for be very careful. Okay. So we get to which we call low birth weight. So low birth weight is like anything between 2 to 2.5.
2.5.
1.5 to 2.5. Then for moderate low birth weight, anything between 1 kilogram to 1.5 kilogram, and extremely low birth weight, anything below 1 kilogram.
1 kilogram.
Okay, yeah. So these are the different birth weight ranges.
Okay.
So when you begin the 4 kg and above is suggestive. So one of the two one know if the mama gets diabetes. Another thing, because of the pikin too big, it can make what we call shoulder dystocia. Okay, that's the pikin, they get nerve compression and not the able the passage because it's too big. So we get what we call the power, the passage, and the passenger in obstetric.
Okay.
So the mama for get enough power for push, the passenger for the in the right position and presentation for come out, and the road safe for fine for let come out if we able born normally. So if problem they by any one of the one they are likely for let buy for let born for yourself,
Go
slim pass them go do cesarean section, one I can call CS. Okay. So because of the high blood sugar na the mama in blood, it can affect the lung maturation where the pikin dey inside the mama in belly. So this they make, if you born the pikin, it will cause what we call fetal respiratory distress syndrome. So now them pikin where they can born, where they can bag, they go put oxygen, but they can see they can push and then they press their chest. Okay, because the lung they not develop better. So we get one thing we call the surfactant. We mostly can develop between 33 to 36 weeks. Okay, so if another effect of this is the cause premature birth, that you born before time. So if we foresee say you get for born before your time, we give it you call corticosteroid for help, because then they can help for let the pikin long mature for produce this surfactant. We go help them. That if we don't predict that, if they not a sober hospital where they able monitor, where they go don't predict say this thing go happen, they will give that medicine there, we go help that pikin there.
Okay.
And it cause repeated abortion. So if you know a woman
Or miscarriage.
exactly or
Miscarriage.
miscarriage. So if you know a woman, you dey get them repeatedly. One of the tests the way I go advise let you do na for check.
You diabetes.
For make you know if you get high blood sugar or not. Okay. And also we get what we call intrauterine death, that the pikin dey die inside the belly. So because of the high blood sugar and because it gets effects by the lung, it make let the pikin die before you born stillbirth. Wetin they call stillbirth, we born the pikin not survive. Okay.
Yeah.
So these are some of the effects them of diabetes by the pikin.
Okay, so I so sit on the concentrate. Okay. So one for no now, one for go forward. There are so many complications and so many things. As like you said, diabetes is a broad topic, and as you they talk, first if I not say yes, there's so much more to know. You understand them? So one for look at how the glucose levels them go affect the woman, especially we make mention of even infection. Yes.
So glucose they predispose diabetes they predispose woman them to infection. Okay. Because you find out that as woman then they go towards menopause, the level of production of the hormone estrogen and progesterone we get cytoprotective effect for protect cells in the heart, and they cause that normal secretion where woman can secrete very good for wash and clean and for maintain the normal flora of the vagina. Okay, so as they don't reach menopause, they not get handy again. They not put that level of estrogen and progesterone, they decline. Okay, so they're not able to produce that secretion where they maintain them vagina from infection. So this they predispose them more to infection. And one of the infection now which we call candidiasis. Okay, candidiasis na a fungi they cause them. Okay, you get different candida species then. Okay, so this candida mostly because diabetes gets an immunosuppressive effect. It suppress the immune system. So just like HIV and AIDS where they cause immunosuppression, diabetes back gets the tendency for cause immunosuppression. So where it suppress the immune. Normally these candidates then and a normal young female when not reach menopause ain't no go get them.
No.
But for who that don't pass menopause, they get diabetes. The risk for they get high because as I say, it don't lost and not they produce waiting for produce again, and the balance don't be altered. So they get a candidiasis infection. So the person will get so if a man, they go get what you call so the broad the balantitis that they get infection and or inflammation of the glands penis that they cap. Okay. Yes. Then also the woman back can get vaginitis, inflammation of the vagina. Cause that.
Okay. Okay, well thank you so much. We don't almost run out of time actually. So make we just quickly wrap up the program. Of course, we don't of course understand so there are 4 types of diabetes: type 1, type 2, diabetes of other causes, and gestational diabetes. We don't understand what's not type 1 diabetes. Of course, then a decline in insulin, right? And then one way for treatment, or like the major way for treatment, a continuous intake of insulin, and then they go for live with them for the rest of your life. And then of course we get type 2, where that the most common one, where we can see nearly every person can get them. Of course, in say number 1 that they check your diet and make sure so you exercise. Diet and exercise are one part of the major thing. But not do that pass mark way so that you know we go to get low blood sugar level back. So you for do according to doctor's description. As much as you don't want to forget high blood sugar level, but you know for doing back the pass mark one so that you know go get low blood sugar level, right? And then of course number 2 now, when the first results well man will say fail but you know work, we go come to number 2 now, where I go be prescribed for you medicine, and then of course you go get for take them up with the doctor or the with stuff we do go see. Not go visit quack, please go to a very specialized hospital for that. And of course we understand so we get diabetes of other causes. Them we get gestational diabetes, we're different from diabetes in pregnancy or pregnancy in diabetes. Okay, so gestational pregnancy means that the pregnancy now cause the diabetes, and then I would say the 5th one, diabetes in pregnancy. That means if you already don't get the diabetics before you get pregnant, and of course it's very advisable for make you consult with your doctor before that, so that when I go able to avoid most of the risk or minimize the risk for make the picking self not be disadvantaged or come out wrong. Yes. Okay, so waiting having the next one self, and waiting we talk about and just now before we close we talk about
the effect of picking.
Yes, the effect in the picking, and waiting you go do me I go advise you seriously go to visit your doctor regularly. Visit your doctor on any decision we going to take, especially when you know say they in that diabetics you don't confirm say you get diabetics. Visit your doctor please on any decision. Make just go do something with them. So before we close up the program, Dr. Amara, what do you get for viewers them out there? But like you as much to viewers out there, especially the one the way they go through diabetics.
Well, diabetes can be managed and can't be treated, but if you follow waiting a good doctor say, you will live a normal life like anybody else and live the normal life expectancy without you dying prematurely. So the major thing we can get even our clinics is in hospital for let the patient then be compliant with the medication. Like it can say me I don't tire. We can understand because for take something for lifelong, you know, easy not so food. What we can do, we just can encourage, say we explain them why they for continue because now for their own well body one. So if you they out there you get diabetes, and one for make you take and say no you don't know, with a proper management plan you go live a normal life and you go live long without any of them complications then come up.
Okay, so thank you very much for joining us to for the program, Dr. Jessie Amara. Thank you so much for being here, and Boku thank for the message, the knowledge we don't pass across. Mr. said on learn a lot, and of course to my wonderful viewers them out there, thank you so much for joining me on the program today. I forget to say the program we watch now the wellness program. We can come to you live every Thursdays from 6 p.m. to 7 p.m. on Redeemer Television Channel 25, and of course on social media pages Facebook and YouTube, Redeemer Media Television. Okay, so we go encourage you, make you stay tuned for till next Thursday. We want to say Boku thank to we camera operator Jessie Indogo, VCR operator Paul Flomo Jr., we producer Daniel Mover, the technical team Joseph John Toure and Mr. George Campbell, and of course the manager Daniel Misali, and all who that we join and for make this program so reach you like how it reach you. So, and of course to the media team Solomon Fofana, and of course Musa Samuel. We want to say Boku thank, and till next week Thursday we will be done being the presenter Mina Shirley Williams, so stay tuned.